మీరు వింటున్నారు ఎఫ్ఎం అంటే రేడియో సిటీ 91.1. నేను ఆర్జే అనూష. యాక్చువల్లీ నాకు చాలానే డౌట్స్ ఉన్నాయన్నమాట. ఇందుకే నా డౌట్స్ అన్ని స్కూల్లో అడుగుంటే ఎప్పుడో బాగుండేది, కానీ స్కూల్లో ఆన్సర్ చేస్తారో తెలియదు. కానీ హియర్ వీ హ్యావ్ డాక్టర్ మాధవ్ దంతాల. హలో డాక్టర్.
Hello.
So doctor is a senior consultant, medical hemato-oncologist, Omega Hospital, Gachibowli nunchi. So first ga, how are you doing, doctor, today?
I'm good, Anusha. Thanks for having me here. And I think it's going to be a very interesting conversation.
Absolutely. So basics nunchi start cheste. What exactly is this Hodgkin lymphoma? Did I pronounce it right?
Hodgkin lymphoma, but yeah.
Hodgkin lymphoma. Okay. So Hodgkin lymphoma. So how is it different from other types of cancers, doctor?
Yeah, so the reason why we're talking about Hodgkin lymphoma is September is Lymphoma Awareness Month.
Right.
And lymphomas are basically a type of blood cancers, right? So when you're talking about blood cancers, we're basically talking about leukemias, lymphomas, and myelomas. So these are the three main types of blood cancers. Right. And then if you want to break down the types of lymphomas, you have like non-Hodgkin and Hodgkin lymphoma. I always give the example of a car, right? If I asked you how you got here, if you tell me that you just got here in a car, I wouldn't be able to paint a picture. Mm-hmm. The more questions I ask you, whether it is automatic, whether it's manual, whether it's electric or ice. So the more questions I ask, the more questions, the more answers I get, the clearer the picture becomes. So likewise, when I just say blood cancer, it can mean anything. When we talk about lymphomas, then again we're talking about non-Hodgkin and Hodgkin. Then again in Hodgkin you have a lot of subtypes, right? Okay. So all of this gives us information as to how we have to treat it, how we have to diagnose it, what it means for the patient to have each of these types of blood cancers.
Cool. So how common is this Hodgkin lymphoma in India?
In India, I mean, the incidence of Hodgkin lymphoma is pretty similar to what it is in the rest of the world. Mm-hmm. And if you're looking at blood cancer incidence per se, they would make up roughly around 15% of cancers. And then say the incidence of Hodgkin lymphoma, you're looking at something known as a bimodal incidence, which means you have the first peak in the mid-second decade. So you're looking at patients being diagnosed between the age of 15 to 25 to 30 even. And then you have a second peak after the age of 60. Right? So if you're looking at childhood cancers per se, Hodgkin is, it makes up around 10% of childhood cancers, I would say.
Oh, who tends to get it like?
There's no particular reason why. I mean, you cannot pinpoint why a particular child or even an adult for that matter gets Hodgkin lymphoma. There are lymphomas diagnosed in the background of, say, immunosuppression, like you have patients with, say, HIV or maybe some other autoimmune condition, and there's a lot to do with a dysfunctional immune system and immune suppression and getting a lymphoma. But for a majority of them, we have absolutely no reason as to why they're diagnosed with Hodgkin lymphoma other than, we know what to do with it once they're diagnosed. We cannot really pinpoint and tell that particular patient why they have Hodgkin lymphoma.
All right. So what are the symptoms that people should watch out for?
Symptoms now, if you look at the symptoms of Hodgkin lymphoma, they're very common in terms of like you would present with a fever, you would present with a loss of appetite, a significant weight loss, which is basically losing more than 10% of your weight in the last 6 months, and involuntary, meaning you're not on a diet and you still lose weight. And you also have profuse sweats, like you might be sitting in an air condition and you still might feel, you might be, having drenching night sweats, right? These are referred to as B symptoms. Now, the other common symptom is now because it's a lymphoma and it is basically, you're going to get lymph nodes that are involved, part of the lymphatic system, and you have these spread throughout your body. Right from your tonsils to your submandibular, submental nodes in your neck. You have all these neck nodes. They can be in your axilla, they can be in your groin, or they can be in your chest and abdomen as well. So depending on the size of the lymph node, you might either feel it when you're taking a shower or even, when at other times. Or if they're in the chest and the abdomen, they're going to have compressive symptoms. If the lymph node gets to a size big enough to be causing a compression, say around, say, the blood vessels in the chest or the surrounding organs. You might have a cough, you might have shortness of breath, or maybe in the abdomen you might have constipation, or you might have abdominal pain. So depending on the location, the size of the lymph node, you might have compressive symptoms, or you might be able to feel them in your neck, axilla, and groin. So these are common symptoms. Now, the moment you get a fever, don't assume that you have a cancer. It's just that when you have the combination of these symptoms and they persist more than anticipated. So you have a fever, you have a lymph node, you think it's an infection, you take a course of antibiotics, it's not settling, and it's lasting for more than say 2 weeks, then that's when you probably should go and check with the doctor, get your blood tests done, get examined, and also the consistency of the lymph node. Now, when you're talking about infections, lymph nodes are usually painful, right? Because they're inflamed, they're painful, and sometimes they might be warm to touch. But in a Hodgkin lymphoma, you typically have what are known as firm, rubbery consistency nodes, right? And they're mobile. You're able to move them around when you latch onto them. And there are also a few interesting symptoms for Hodgkin lymphoma, right? So generalized itching is one. So you might feel itchy for no reason. And a very uncommon symptom, but that's specific for Hodgkin lymphoma, is increased pain in that lymph node when you're having a drink, right? So when you have alcohol, your blood vessels dilate, and because it's a highly inflamed environment, the blood vessels are going to get dilated, and then you have this capsule around the lymph node, and that lymph node is not going to be, when that stretches, that's when you have pain. So alcohol, you have a lymph node, it's painful. That's a very interesting symptom about Hodgkin lymphoma.
Oh my God. This is like too much now. So I was just worried, fever and this, and I was like, okay, I don't have it. So everyone thinks the same. But doctor, what if someone approaches a doctor with all these symptoms? How does a doctor diagnose?
So to begin with, we would get the basic blood tests to check if there's a drop in hemoglobin, if the WBC count is elevated, if there's any change in the platelet counts. Then we would do tests like an ESR and LDH to kind of figure out if this really has something to do with the cancer. But the one test that we would do to establish the diagnosis would be a lymph node biopsy. Now, oftentimes, patients go to the general practitioner or, the family doctor, and they're too reluctant to be suggesting like an excisional lymph node biopsy. They would probably suggest something like a fine needle aspiration cytology, and they might, because it's easy to do and it's not going to cause much distress to the patient. But the problem in Hodgkin lymphoma is you're likely to miss the diagnosis, right? Because when you're looking at the lymph node structure in Hodgkin lymphoma, you have these isolated cancer cells that are in a pool of inflammatory cells, right? So if you hit the needle through a relatively normal part of the lymph node, you're likely to miss the diagnosis, which is why the gold standard would be you remove the entire lymph node, give it to the pathologist, and let them figure out whether it has something to do with the cancer or not. Now, once you've established a diagnosis based on morphology, which is basically your pathologist looking at the cells under the microscope, looking at their shape, size, and structure, and judging whether they look normal or whether they look like cancer cells, right? Now, once you've established that based on morphology, then we do certain additional chemical markers called immunohistochemistry, which is basically tests that make sure that there's no inter-observer bias. Like based on your experience, you might feel it's non-Hodgkin's, I might feel it's Hodgkin's. So these things matter. We do a little more tests to make sure we have the right diagnosis. And then you would have to stage it, right? You would have to decide on the kind of treatment that you're going to go with. So you would do a PET CT scan, which is the gold standard for staging Hodgkin lymphoma. And staging depends on how far, and how generalized the spread is. Now, although it's called a lymphoma, we can also see involvement of other organs. The liver could get involved, the spleen could get involved. Sometimes we see other extranodal sites like the bone. So there are a lot of places that the blood cancer can spread.
Okay. So, doctor, how does this treatment look like? The journey, especially once they start getting treated. So, how is it? Is it going to be painful? Of course, yeah.
The most painful part would probably be getting the diagnosis, right? But the treatment is not going to be painful at all. And if one of the things I tell my patients when they're diagnosed with Hodgkin is like, if I were given a choice, to be diagnosed with one cancer, I would probably choose Hodgkin lymphoma, because that was one of the first that was the first cancer to get cured with chemotherapy. And with the way science is progressing and the kind of medicines that we have now, for the first time ever, like normally what happens is when a new drug comes up and you're comparing how well the patients are doing throughout the world, you always tend to keep track of the percentage of patients who respond, those who don't, and you're also are keeping track of the durability of response, right? Now, for the first time in history, you have patients enrolled on clinical trials where 100% of them respond. And if you look at data from 5 years follow-up, all 100 are alive and without disease. So that's the kind of outcomes that we're hoping for in Hodgkin lymphoma. And we are getting to a point where we can confidently say, even if you have advanced stage disease, the likelihood of cure is very, very high. Now, the way treatment has progressed over the years, our initial focus was on trying and achieving good responses, maintaining a durable response, and also, keeping the patient alive for as long as possible. But as time progressed, now the focus is on trying and minimizing the side effects. Because the treatment has such good outcomes. Now we are focusing on giving the minimum amount of treatment possible, minimizing long-term side effects, because the age, as we discussed, there are a lot of children who are diagnosed with Hodgkin lymphoma, and you don't want them to be getting long-term side effects in terms of affecting their fertility, earlier cardiovascular complications like having a heart attack much sooner, or any of the other long-term complications. Our entire goal is to try and minimize those complications. So whichever way you look at it, apart from being diagnosed with a cancer, Hodgkin lymphoma is one of those blood cancers where the treatment has made tremendous strides over the decades, and now we're at a point where we have the answer to whatever it has to throw at us.
Perfect. So the earlier detections, what difference does that earlier detections have made comparatively?
See, when you're talking about early detection, I mean, we have like so much of an information overload right now where everyone wants to know about every cancer and you want to try and prevent certain things. Hodgkin lymphoma is one of those cancers that does not have like a defined cancer screening program, because you could get a blood test done today and say a month later you could still be diagnosed with Hodgkin lymphoma, because that's how rapidly it progresses, right? Now, the key thing to remember is don't ignore your symptoms. Right? If you have a fever and you're down for more than a couple of weeks, you start to feel a neck node, a lymph node in your neck or under your armpit, that's not usual. You start losing a bit of weight. Stop, trying and pushing those symptoms aside and, taking a lot of home remedies and opening up ChatGPT and Google and self-diagnosing and self-treating. Just visit your doctor, get diagnosed and treated. Now, the other thing that you have to remember is when we're talking about treatment for these blood cancers, right? The one thing that is important is disease biology. Okay. Which means to say that the disease doesn't behave the same way in every individual patient. And even if I were to detect it a week later and your disease biology is not so aggressive, I'm still going to get a beautiful response, and it's probably going to melt like butter the moment I start treatment. If the disease biology is such that it has an aggressive clinical course, even if I had started treatment a month ago or you would have received 3 to 4 months of treatment, you're probably not going to see even a centimeter decline in the size of the lymph node. That's not to say that, meeting a doctor only when it's advanced is the way to go, but I'm just trying to make sense of Hodgkin lymphoma as such, in terms of telling you that the way treatment has progressed, it has a very high curative potential, right?
So, perfect. So can we talk about the myths of it, doctor?
Sure, let's go.
So what sort of myths generally people fall into, like, no, this could not be a cancer, or this could be a cancer?
So when we're talking about denial, right, that's one of the stages of grief, right? So everyone has that first stage where it's denial, where they don't want to believe that they're diagnosed with a blood cancer, and then they go through the other stages. Some of them go through it very soon, and all the 5 stages of grief can be done in a single day, and they're geared up for treatment and they're looking forward to getting cured and being normal again. In terms of myths for Hodgkin lymphoma, I don't think there are much, because you don't end up going to a hospital with a fever and expecting that you're going to be diagnosed with a blood cancer, right? I mean, that's how it is.
Yeah. So the swollen lymph nodes always mean cancer?
No, not really. So, if you look at the causes for lymphadenopathy, which is basically any reason that could increase, you can have an enlarged lymph node. There are more than like 80 to 90 reasons for lymphadenopathy,
Okay.
right? You could write pages on lymphadenopathy. So, the moment you get a lymph node, don't assume that it's cancer. There are certain features for a lymph node, like I said, the consistency, and also if it's mobile versus, say, fixed, or if you see some overlying skin changes, if you see any redness, if you see any discharge from that, and also the associated symptoms. Right? You might have some hair follicle infection, you might have a tiny lymph node, that's not a cancer. Right? So there are, you could have lymphadenopathy for several reasons, and cancer is not the only cause. In fact, cancer is one of the most, the least likelihood of it being a cancer if there's a lymph node. Infections top the list.
Cool. So, doctor, see, cancer treatments, yeah, they are painful, and we all know that they lead to the side effects. So, what do you have to talk about it?
So, pain in the sense, so I often get this question about whether chemotherapy is painful, and not really, because all you're doing is you're mixing a drug in some IV fluid and you're giving it through an IV cannula and line, and the process itself is not painful. Right? The pain is really if the complications are severe in terms of mucositis, where the inner lining of your oral cavity or your food pipe or stomach or gut is affected, or you have oral ulcers, or you're suffering from complications like, say, vomiting, diarrhea, fevers, and you're feeling under the weather. But the actual process of delivering chemotherapy is not painful.
Okay. So, what if this Hodgkin lymphoma comes back? Is there any option, or does it really come back?
It does. So again, when we're counseling patients with Hodgkin lymphoma and we tell them, we have these wonderful drugs, not just chemotherapy, there are a lot of options now. Like immunotherapy is at the forefront of treatment of Hodgkin lymphoma. And we're combining immunotherapy with these traditional chemotherapy drugs. Then there are other drugs called antibody drug conjugates, which is a better way of delivering chemotherapy to the body with fewer side effects. Now, despite all of this, we tell them that, look, you're going to be experiencing good results up front. But for me to use the word cure, you're going to have to wait for some time. Right?
Okay.
Now, the highest chance of recurrence is in the first 2 years following treatment. And once we are past that 2-year time frame, then the next 3 years, you still have that slight chance of the disease coming back. But then once we touch that 5th year post-treatment, that is when it's an arbitrary cure. Right? So you can fuss about things, you can get really worried, and but you're not going to get all your answers on day one, because time is probably the one thing that is important. And once we're past that 5-year mark, we know it's a cure. Now, if the disease does come back, then it depends on how soon the disease comes back, right? So if it comes back, say, within the first 1 year of treatment, it means the disease is possibly more aggressive than it ought to be, right? And if it comes back, say, beyond that 2-year time frame, you know that the disease has come back, but it's not as aggressive in behavior. Now, whenever it comes back, it's not the end of the road. There are wonderful treatment options, even in the relapse refractory setting, which means that even when the disease does come back within a very short time frame, or even if it comes back, say, later on, you have options to try and get the disease under control. And we almost always recommend a bone marrow transplant when the disease does come back and you've been able to control the disease. Again, bone marrow transplant sounds scary, but in Hodgkin lymphoma in the autologous setting, you're looking at a death risk of less than 5%. Most centers have death rates of 1 to 2% doing a transplant, which is not much, to be honest. So even if the disease does come back, we have the option of going with salvage chemotherapy, which is a different chemotherapy protocol than what you've received up front. And then we also have the option of consolidating the response that we've achieved by doing a bone marrow transplant. Now, other options that we have, there's something known as CAR T-cell therapy now, which is a very interesting way of treating cancers, that where we arm the patient's immune system. We take certain T cells from the patient's body, ship it to the lab, and use a lot of viral vectors and growth factors, modify them in a way where once we infuse those cells into the patient, the immunity is again, revamped, and then it's able to identify the cancer cells and eliminate them. So there are a whole bunch of options that are there. and I don't think anyone should worry about having Hodgkin lymphoma.
Cool. So how is it living with it or living beyond it? Like,
So, like I said, when you're talking about the incidence, the age at which most patients are diagnosed with Hodgkin lymphoma, I said 15 to 35, right? So, most of these patients live a normal life, right? Apart from probably the 4 to 6 months of treatment that you're going to receive, depending on what stage it is. Once you're past that, it only has everything to do with you managing your emotions in your mind, because you still know that there's the slight chance of the disease coming back, right? And the moment you learn to forget that and you get on with your life, it's a very fulfilling life after that. It's just like any other normal person would lead their life. We have children who follow up a decade later, 2 decades later, they come back, with their wives and children, and patients almost forget that they were diagnosed, right? They have a very remote memory of being diagnosed with a childhood cancer, which they barely even remember what they went through. So life after Hodgkin lymphoma is like for anyone else. Like I said, like we've gotten better at managing the long-term complications. Say if you were being treated for Hodgkin lymphoma in the 1970s and 80s, then you would have to be very worried about the very high risk of infertility later on, or maybe a higher risk of cardiovascular complications in the follow-up, because radiation was a part of treatment of Hodgkin lymphoma as well in the past. And it still is, but our techniques have gotten so good that we can avoid any form of radiation to the organs that matter. So for patients who were treated, say, decades ago, and they're growing up now, they probably have all these long-term complications to worry about. For patients who are getting diagnosed now and getting treated, they don't even have to worry about that.
cool. So can individuals, have a normal lifestyle, as soon as they finish the treatment? Can I get back to the normal?
Yeah, so there is this whole concept of integrative oncology, right? Where I tell the patients that apart from me giving you chemotherapy, writing your protocol, and learning to manage your side effects, there are a lot of other things that you can focus on as well, right? Where we're taking care of your nutrition at home. You can continue to engage in physical activity. You can choose to do yoga or any isometric exercise. You can have friends and family over with some precautions. So you must try and lead a normal life as possible. I know it's easier said than done, and some people, do it better than others. But we almost always, continue to encourage them to get back to their normal routine. It also depends on your job, right? If you have a desk job, you have an IT job, you're going back to an environment that's not too infectious, then you could still resume work as early as possible. I have a lot of patients who bring their laptop to during their chemotherapy and continue to work, right? For patients who are, say, in a profession like medicine, where you have to go to a hospital and that's your work environment, there might be some difficulties. But most of our patients depends on the doctor who's they're engaged with, and we become philosophers after a point of time, and we are also like your spiritual guru of sorts. Yeah.
Wonderful. So in general, you tell me this, doctor, see, can cancer be prevented? Any sort of cancer?
Okay, so when we're talking about cancer prevention, any sort of cancer, I mean, there's this concept of screening, okay, which everyone should be aware of, all of your listeners. So if you look at women, they have the option of screening for breast cancer. They have the option of screening for cervical cancer. And for men, they have the option of screening for prostate cancer. And any heavy smoker who's smoked who has more than 20 pack years of smoking. That's if you smoke a pack of cigarettes a day for 20 consecutive years, then you also qualify for lung cancer screening. So these are 5 cancers that can be screened, which means to say that you have the option of picking up the cancer early, intervening, and treating it with as minimal as possible, right? So not all cancers allow you that screening, right? So when you talk, there's this concept of if the cancer is like a bird, right? By the time you realize it's flown over, those are the cancers that cannot be screened. Say like a blood cancer, for instance. Because of the rapidity at which it progresses, even if you were to get tested today, you can still be diagnosed a few weeks later with the blood cancer. Right. So such kind of cancers are not suitable for screening, right? Or say a tortoise, right? That's moving at a very slow pace. Even if you were to pick up that kind of a cancer, you're probably not going to change the outcome. It's like one person is diagnosed. There's something called as lead time bias, which is a very interesting concept, where say there's a person who's diagnosed with cancer at the age of 65, another is diagnosed at the age of 68, and both of them die at age 70. It's just that one knew longer that they had cancer, but their outcomes are not very different. So there are cancers like that, but the ideal cancer to screen would be something like a rabbit, which is faster than a turtle, but is not as fast as a bird, right? So it still gives you that opportunity to identify it and target and treat it quite early. So the cancers that I mentioned, breast, cervical, prostate cancer, lung cancer, these are the ones that can be that have screening programs. Apart from that, the usual, whatever you've been listening to, everyone, all your health influencers, doctors, everyone asking you to quit smoking, don't consume too much alcohol, be physically active, and make sure you have good eating and habits and you sleep well.
All right, perfect. So here we go, doctor. So to all the youngsters, so what are the 5 tips that you want them to follow? Like any 5 rules that you follow?
I think this generation is very health conscious, right? I mean, can you even imagine having a conversation about exercise and HIIT training and all that with your parents? Not really. This generation, I mean, we're the generation that wakes up in the morning, tries to have like an apple cider vinegar or lemon water, goes out for a jog or physical fitness, whatever choice, either sport or you hit the gym, and you're watching what you eat, you're measuring what you eat, and you're very aware of how to take care of yourself, right? So I mean, I'm a doctor, but I know the general public is as aware as a doctor in terms of safeguarding your fitness and living the right way. Those who choose not to do it, they're the ones who are like, chalo, I mean, let's enjoy our life and whatever happens, happens. So it's more to do with dealing with your personality than, a lack of awareness of how to lead a fit life.